Okay.
Well,
Did you try to share?
I can.
Okay.
Okay, welcome everyone. Thanks for being here. Amanda and I are going to talk to you a little bit about the program, and Rachel will probably jump in a little bit too, especially with some questions maybe we're not able to answer. So we're glad you're here. How is your first semester freshman year going? Probably doing a lot of adapting. Yes, everyone's smiling. Yes, okay. Well, that's good. I actually think that's a really good skill. It's going to be a skill that will help you as you transition into the DMS program. So I'm the program director. My name is Lisa. Most of you I've met with at some point or another. And then Amanda can give a little wave. Amanda is my partner in all of this, and she is also an educator for the program, and she is responsible for a lot of the clinical components of the program, which are the bread and butter. Everything like you really need comes from that clinical experience. So let me share my screen. And I'm just going to walk you through. At any point, if you have questions, it's not a very large group, so feel free to just unmute, or you can throw something in the chat if you're more comfortable. And Rachel, if you wouldn't mind just taking a look at the chat and letting us know as questions come in. Rachel, are we how long do we have for this meeting?
I scheduled it for an hour, so.
Okay, I don't think we'll need that long, but we certainly can if you guys want to chat more about it. So I just want to review kind of where you are at currently. So leading up to the DMS program, you are going to be working your first 2 years, kind of chipping away at the core that Concordia has outlined, and then liberal arts dimensions. And those are the liberal arts requirements are how we're able to issue you a bachelor's degree, which is a really good, it's a good foundational degree for you to leave this program with. It allows you more opportunities than just a certificate or an associate's degree. So you are in a good place with a nice foundational degree at the end of all of this. In addition, and you maybe haven't started chipping away at many of these yet, but you will, are some of the prerequisite courses for sonography. I'm going to move to the next slide here. So the reason we have so many required courses is it really gives you a nice foundation for entering the DMS program. Some of it will be familiar when we start talking about it, which is really helpful because we do have a lot of curriculum that we need to provide you in order to graduate you as diagnostic medical sonographers. A lot of the courses that are listed here, actually all of them, are standards that our accrediting body has set for us. So the accrediting body is CAHAP. It's the Commission on Accreditation of Allied Health in Educational Programs. So math, physics, communication, anatomy and physiology, ethics, medical terminology, pathophysiology. And then at the bottom here, CAHAP also requires students to have a patient care course. We recognize in Wisconsin, at least, that it's really important for you to come into this program having some experience in caring for others in a healthcare environment. So in lieu of having you take a 3-credit class in where we talk about how to take care of a patient, we actually have you take the CNA certification and then work at least 100 hours. It is so beneficial. You will be able to tie into experiences that you have as a CNA throughout your career. And I say if you can find happiness and joy working as a CNA, you are definitely in the right place looking for a ultimate career profession in healthcare. So I put down here, the more you work, the better. Sometimes students will continue to work as a CNA throughout the sonography program. And some will say, that was good, I had enough and I'm okay. Or some say, I maybe don't want to juggle work and school. All of those things are fine. I would say, though, if I had to pick, try to get as many hours under your belt before you sit down and interview with us. I realize that COVID is throwing a little bit of a challenge into getting the CNA requirements, so we can certainly have conversations about that at some point during this meeting.
A little bit about the CNA, full disclosure, and why I feel like this is really important. When I started chipping away at my prerequisites, I didn't have to get my CNA. And my story, you'll probably hear it multiple times. I am a Concordia graduate, but the program was a little bit different back then. And we didn't have to get our CNA. And I had nursing background prior to this, so my application was kind of pushed really quickly. But when I got working in the field and even in clinicals, I wasn't feeling comfortable about like transferring with a cart. I wasn't great at knowing how to use a gait belt, which is a safe way to transfer your patient from a wheelchair to a bed and a bed to a wheelchair and things like that. And some of the people who had CNA background, and even now I know who has worked as a CNA or still works as a CNA because they feel really comfortable. It's like second nature to them. So they aren't focusing so much of the anxiety of how do I work all these mechanisms. They are focusing on how do I learn ultrasound. And so I think that's a really big step forward. And I think it really helps in the beginning fall semester of your junior year.
Great points. Thank you. So that was kind of the coursework essentially. And then there's some additional things to note. 8 hours of job shadowing is required for sonography majors. Now, if you have somebody that's in RT, those requirements are a little bit different, but we want 8 hours, and we want that broken down into 4 hours of observation in a general vascular department and 4 hours in cardiac. If you tell, and the reason is that we have different concentrations of sonography, and we really want you to make an informed decision. So you have the option as a Concordia student to choose either general vascular as a concentration or cardiac. Cardiac is also paired with vascular, and we'll talk about that in a little bit. Sometimes students say, well, I really know I want to do general. And I think still I would encourage you to do both. I think it just gives you a good idea of what sonographers can specialize in. So that is, and then notice I also have minimum here. If you are interested in doing more observation and you get the opportunity to, again, COVID has been a little bit challenging for this, you can certainly do more. CPR for healthcare professionals, that is not required at the time you apply to the program, but it will be a hard line before you start clinicals. So you would definitely need to have your CPR completed before the fall semester of your junior year. The 3.0 grade requirement, I put all the classes here. Basically, it's all your DMS prerequisite courses with the exception of physics. Physics, we allow a C. Physics tends to be the more challenging class out of all of these listed. Some of you might have differing opinions on that. And if you're having trouble with certain classes, please reach out to Rachel, me, Amanda, or all of us. And we will try to get you some tools that you need to be successful. The C in physics, we have found is more than a sufficient grade to allow you to be successful in the body of the program. In the body of the program, we will give you more physics, but the physics that we give you in the program is going to be very specific to how sound moves through the body. And believe it or not, it actually is a little more interesting when you can kind of learn about physics and formulas, but then actually see it in action when you're in the lab or in the clinical setting. So I am not a lover of physics. I say that all the time. Amanda is nodding her head yes. I think it's cool how it works. I am not physics minded. I understand it to the nature that I can do my job, my profession well. So I don't want anyone to be deterred or nervous about physics. certainly we need to get the grade requirement. So work with us if you're really struggling, get involved in tutoring, or it's called SI, right? Supplemental instruction. So all of those things can be really helpful. And finally, the 3.0 GPA, we are really looking at science courses. Most of your science courses live right here. So if you're getting the B or higher, you're in good shape. Some other classes that might fall into this GPA averaging would be biology. I know biology can be challenging. So remember, you have all of these science classes that will be averaging against that or with that. So keep that in mind. I know biology is tough sometimes for students. Okay, so here are the two options for CUW students when they're preparing to apply. There's basically 3 silos or concentrations at this point in time. That is changing for sonography students. So you have a general silo, and that includes all the abdominal organs, superficial organs, and obstetrics and gynecology. That's one silo. And then we have another silo, and that's all vascular imaging. So cerebral vascular, peripheral vascular, all the arteries and veins in the body. And then the final silo is cardiac. So the one thing that lives kind of in combination is vascular. Vascular will live with the general concentration, and it'll also live with the cardiac concentration. So either way, you will get vascular experience in your education. Concordia has just a general, we have a general vascular program here, and we have a partnership with Aurora that offers a cardiac vascular concentration. In addition, they also offer general and vascular as a concentration as well. So as a Concordia student, if you choose to apply to the general vascular concentration, you will apply to us first. And then if for some reason we are not able to offer you a placement, we could then forward your application to Aurora, and they would review it and potentially offer you an interview and placement. So you kind of have two program options for placement. If you are just interested in cardiac and vascular, then your application would automatically just go directly to Aurora for placement there. You might say, I'm not sure, and that's totally okay as well. So we would say apply to both and see where your offers lie. And we can talk about this again next year at this time, but just something to think about as you're shadowing and observing and maybe doing some research, that you have all available options are available to you as a Concordia student. Any questions so far? This might be a good place to stop just before we get to like a year from now.
So going back to a couple slides before about the GPA requirement and how you look mostly at the science classes, do you look at all of our other classes as well, like as our GPA as a whole as well, to make sure that is above 3.0 as well?
We emphasize the science courses, so that's a great question. We are going to look at your overall GPA, but our partner at Aurora is specific in the GPA for science. So we, just to be a little more consistent in alignment, we're trying to follow, not to make it so challenging. So if you have an English class that maybe didn't go so well, if your science is strong, that's what we're most concerned with.
And feel free to reach out to Rachel, Lisa, or I if you have a specific, this isn't going well. Is this going to like blow my chances? That kind of thing. If you don't want to ask in a group setting at any of these meetings, just feel free to reach out to us.
Okay. Yes, so our goal really is to make sure that you're feeling supported and successful in these first 2 years. So this transition into sonography is easy, and you're successful in getting into the transition to sonography. So, Let's talk about the application process. I feel like in years past, we maybe didn't visit this until your sophomore year. And I think knowing what is expected of you a year from now is helpful, right? You can plan ahead. So application, you'll fill out a formal application. I'll show you an example of that. We will look at your transcripts. So high school transcripts, college transcripts, and we just look and kind of see kind of you as a whole student so far. Then we are going to request that you send us verification that, so this will be your CNA certificate that you indeed attended a program and graduated from that program, and that you have your license. And then your employer, where you gained your hours worked, will send us either a letter verifying how many hours. Sometimes we just get your time sheet. Anything like that would work. And then finally, you have a shadow form that every time you shadow in sonography, you would have the sonographer that you worked with kind of sign off that you were there, what area or concentration you were observing, and then how many hours you were there. Two things that we haven't talked about yet that you can kind of start thinking about now. You certainly don't have to ask for references now or write a letter now, but start thinking about maybe experiences that you could share with us in an essay, in a letter. So it's a 300-word letter that is going to basically give us a little insight before we meet with you in person on why sonography, why are you choosing healthcare? Is there a backstory? What led you to this point in your life? A lot of things that your storyline might make you stand out a little bit from someone else. So we like to get a little preview into who we're meeting, and that is done via that personal essay. And then we'll ask you to submit 2 reference letters. I always say at Concordia, I'm comfortable if you want to submit a 3rd. I'm totally fine with that. But our partner at Aurora, they only want 2 letters. So if you want to just submit 2, and that's totally fine with me. If you have an extra one that you really want us to see, just submit it to the Concordia program. Reference letters, a professor that can speak to how you are as a student, and an employer that can speak to how you are in a work environment. Those are 2 strong, if you can get 2 strong letters of reference from those 2 types of individuals, that's really what we're looking for. We know that your family's going to write a nice letter about you. We know that, I probably would encourage you to even get a college professor versus somebody from high school, somebody more current in your academics. Rachel, do you have anything to add? Anyone else they could consider?
Like some of you, if you've had other part-time jobs, your supervisor's there. I've seen like pastors, if you do a lot of work at your church or something like that.
This is everything we talked about. So when we give you your application next year at this time, at this meeting, you will have this all outlined. So you get a little preview today. Shadowing. Shadowing has been difficult, getting observations. Is anyone in this chat or in this Zoom meeting struggling with that? You want to raise your hand if you're struggling to find observations? Okay. You are not alone. Even some of your fellow students in the sophomore class are struggling to get some of these experiences finished up. So I don't think we have to be aggressive and do this right now, but if you are kind of interested in learning more about sonography right now, we can share this document with you. And in the event that by next summer, we are still looking at kind of restrictions with students coming in to observe, then maybe we'll go ahead and move forward and put this officially into play. I don't think anything can truly substitute for an actual experience in a face-to-face environment, but this is the next best thing. So our partners at Aurora came up with this, and we're going to use the same guidelines that they have established just to make it easier for you guys. So if anyone is interested in this, or maybe Rachel, we can just circulate this and they can just view. You don't have to do the exercise here until we let you know. But if you're just curious, you can go ahead and watch these videos. Give you a little preview into what's ahead. Okay. So another thing that we want to emphasize with students that in the past, maybe we weren't always emphasizing as much as we should, is really the importance of the interview. The interview, from my perspective and from Amanda's perspective, and probably any faculty in any DMS program anywhere, is so, so vital. We can't emphasize it enough. We want to know that, you know, really your third week of school, your junior year within the program, you are going to be out in the clinical setting working with patients. Now, your involvement initially is going to be pretty minimal, but you are going to be in on exams, and you're going to hear stories and look at, you know, difficult situations, and how you will handle those is, you know, really important for us to kind of get a sense for and to get a preview into. And we do that by interviewing you. So up here, and I want to say this is full disclosure, these are our requirements at the CUW program. So we are going to look at your qualifying background and we're going to issue you 10 points. We are going to look at your academic background, your transcripts, and that's worth 30 points. Your letters of recommendation and your personal essay are each worth 15 points. And then your interview is worth 30 points. So all this work in your freshman and sophomore year, as important as that is, right, it's equally as important from a point standpoint that you are able to come in and effectively communicate with us. That doesn't mean you have to know everything there is to know about ultrasound, right? That's what we're teaching you in the program. But do you understand a little bit of kind of what it's going to look like? And what kind of experiences have you had? Challenging times where you have, you know, gone above and beyond. If you've had enough job interviews, it will be very similar to a job interview. Let's see. We have a panel of people that sit in on these interviews, and it's typically done just in a conference room here at Concordia. We set up some time. Everyone gets to score you on your interview, and all those scores are averaged. So the highest of the score averages are the students that we accept into the program. So things that you can do now that can help you with this interview process is work as a CNA, work in customer service, whether it's retail, whether it's counter service or drive-through service, or waitressing or bartending, anything that allows you to work in customer service. It will be very valuable, right? We know that we're not always making people happy all the time in customer service. So how do you make things right if somebody's having a tough time? How do you go above and beyond to correct things to make someone's experience better? That's kind of what we're looking for. Amanda, anything you want to add to that?
No, I think you did really good. Usually I do have stuff to add, but they did really good.
You can do mock interviews. You can reach out to Rachel, and when not now, you know, when a year from now, and you can start prepping. So prepping is important. That's the takeaway. This is just the timeline that we talked about. If you are applying to the CUW General Vascular program and not get an offer, then we would send your application over to Aurora St. Luke's for consideration. They have an excellent program. I'm a graduate of that program. They are accredited. They have a ton of clinical sites and opportunities for students. So I have no doubt that a student will get a well-rounded, excellent educational experience within their program. Cardiac vascular, again, you will just be forwarded right over to that program. All your offers, because this is occurring in January of, not this coming year, of next year, so 2022, you will be interviewing with us. And all offers will be contingent on that you successfully complete any outstanding requirements. You'll still have a spring semester to complete. We already introduced us, but we want you to know that at our program, you are in good hands. So Amanda and I collectively have, gosh, we have a lot of experience, 40 years, almost,
50.
right? 39 years, probably 40 if we add the months in now. So you're in good hands with us. We love what we do. That's why we teach. We want to share our passion for it. So if you look here in red, this is what we cover. So we are really responsible for most of the curriculum you will get. We also have an excellent crew, an excellent team that we've built over the last couple of years. We bring in sonographers that are in the community working clinically that have a niche in specific specialized areas of ultrasound. So we have a pediatric adjunct faculty, a musculoskeletal adjunct faculty, and we have some faculty that kind of fill in and help us out where needed because they have a specialty across many areas. And we also have some clinical lab assistants. They are going to work with you in the lab. They're going to work with all of us collectively. They're going to come out to clinical sites and check in on you and make sure that you are still feeling supported in the clinical setting. We have Mark Wojciechowski, who teaches everything physics for our program, and we love to have him because Amanda and I would rather not teach that.
He loves physics.
loves
Loves. So you want someone who loves to teach. Right?
Okay. And I don't want to go into this too much, but you're all aware. If you're not aware, you should start kind of prepping yourself that the program will look different once you get into the junior and senior year. Once you're in the program, we are going to take a little more of your time because we want to be able to give you everything you need to be successful in the profession. So, and we are obligated by our accrediting bodies that you have so many clinical hours. So when you kind of look at the curriculum and look at the clinical hours that we're required to provide you in order for you to graduate, it winds up being about 40 hours a week that in some way, shape, or form, you're either in a clinical setting or you're in class with us or you're in the lab working on skills. It sounds probably a little overwhelming, but it is really the best way to learn. And I'm going to leave you with that. I think that at the end of this, we never have a student say, I really feel like we could have done that part-time. No one ever says that. Sometimes they say, I'm not ready to go yet. Oh, just one more month. Okay. A few other incidentals that you'll have to do before if you're given an offer, we'll get a background check. That's required for all healthcare workers, regardless of where you work. And you probably had to do it as a CNA if you've done that part already. A drug screen. We're going to make sure you have all your vaccines up to date. We'll do a physical to make sure you're in good health, to be able to meet the physical demands of the program, of the profession. We also have an additional fee that I like to point out. Your books are obviously extra. Your books are, Amanda, do you know about the cost of the books, or Rachel? I think they're under $1,000. They're 5 books and a workbook. 5 books and a workbook, 2 vascular books, a physics book, and 2 kind of a double volume of general imaging, and then a workbook. I think collectively you're spending under $1,000, and those carry you through the whole program. Those are the only books that you need. And you'll probably want to hang on to them even for a little while after school. All right, I'm going to let Amanda just talk about clinicals because that's an important piece of your education.
So we're just kind of letting you take a little peek at what clinicals we have available to us and where you will be stopping at throughout the 2 years that you're with us. And really for the sake of maybe thinking about where you want to live or strategizing, how long your driving distances are going to go. We go all the way north, as I guess Sheboygan would be the most north, right? Or would Fond du Lac? Yeah, Sheboygan, and all the way south to Kenosha, I guess. Yeah, Racine, Kenosha. I'm not a southern bumpkin. I'm a northern bumpkin. So, so we do splay a very far distance. However, most clinical sites will be within an hour. So that's kind of our what we try to stick with. That you will only be driving an hour for these clinical sites, and the ones that are far, we really feel like they're important and that you learn a lot from. So we really feel like the distance is worth going to. I feel like a lot of students really, if they had to choose or could choose wherever they wanted to live, like the Tosa area, outskirts of Milwaukee area would be a good strategy. Even really, honestly, campus is not a terrible, hop on the freeway. You can kind of head south down 43, head north up to Sheboygan. Really not too bad as long as you're kind of close to a freeway. If if it's getting closer and you've got an offer and you're concerned about where to live, you can reach out to us when you're a little bit further into the process. But another part of showing you the slide is if you look on this site or on the slip, we've got 23, because we unfortunately did lose one site.
Yep, and we have D's.
Continuation. All right, so 29 sites. I was just going to mention the MEC1 sites. Look at you updated it. Good job. So we've got 28, 29 sites that we go to. You may not go to every single site. There are some that, depending on what specialty they offer, we might split up your class, especially when we have a larger class. But we love these sites because there's a lot of variety. So you don't just learn one hospital system, you learn multiple hospital systems in the Milwaukee area, which entail different ways of protocols to do their exams. You deal with different types of radiologists, you deal with different tips and tricks that these sonographers have learned on the way, and then also different types of machines. So they're probably in the Milwaukee area. Your top 3 are called Siemens, GE, and Philips, and you will get exposed to all of those. And even within those large companies, they have different models, makes and models, kind of like a car, right? So you will be exposed to all these different ultrasound machines, all these different protocols. And why do we think that's important? We think it's important because it makes you really well-rounded. So we have had Concordia graduates go to Arizona or go to systems that they're not familiar with, and they do really well at these new systems or states, going out of state, because we've given them a ton of tools to be adaptable. They aren't just learning one way of doing things, they're learning multiple ways. And when you guys start the program, you're going to realize it's a little frustrating at first, but ultrasound isn't always textbook. We're dealing with human bodies. We can teach you how the textbook reads, and then probably 5 years down the road, you're going to text us or email us and you're going to say, so I had this patient that had X, Y, and Z happen, and it wasn't textbook. So you'll learn that around along the way, that we say, usually we see it this way, however, it can be this way. So I'm really proud of all these sites. Since I onboarded like 2.5 years ago, we probably doubled our sites. Do you think, Lisa? Yeah. Freighter was a big one that I brought with, because I used to work for that system, or I still do work for that system clinically. So we're really proud of all those sites. Hopefully you'll appreciate them too. All right, so ables of a sonographer. I think Lisa touched on a lot of these when we were talking about the interview and why we feel it's important to have your CNA, and we want you to be show us that you can go into these clinical sites and communicate and think critically and kind of do all these things that sets you up to be a good sonographer. So Lisa just did a quick list from a ultrasound society that we use, AIUM, and just kind of a quick rundown of what makes a good sonographer. So like I said, thinking critically, comprehending and interpreting the written material. So we're going to give you coursework, and then we're going to have you apply it in the real world. So we want you to be able to kind of connect those points, and we give you lots of repetitive ways to do that. We want you, again, to effectively communicate. So you're going to be talking to multiple different personalities, multiple people in different status roles. So management and radiologists and ordering doctors, and then fellow sonographers, and then your instructors. So we want you to be able to kind of work through how to navigate all that. And really, once we get to, we're going to teach you the actual physical scanning skills, but we want you to be able to accurately take what we've taught you and apply them into the real world. And then, of course, we talked about getting a physical. You have to be able to physically be able to transport a patient or maneuver a patient. We aren't asking you to lift a patient. We don't need like muscle builders or anything like that, but you'll learn there's different ways to move a patient safely with one or two people. So we just need to make sure that you're able to do those types of things. Any questions on the clinical sites, or is everyone kind of familiar with hospital systems around here? That some of those looked familiar? Do we have any out-of-state people that may not have recognized any of them? Kinda. Okay. They're all within, like I said, an hour of Concordia. Actually, probably under an hour of Concordia. If you lived by me, an hour drive very north would be the longest, because I just went to one of our south sites this morning, actually. And then here is our scan lab. So we're very happy to have a couple extra systems this past year. We got 2 more systems than this picture is showing us, but we have 5 systems total that we are able to use and practice on each other. Again, we have a nice variety of systems. We have Philips and we have GE. So again, another way you guys can be versatile and adaptable. Right now we're doing Scan Lab on Fridays, and then some additional hours here and there for you guys to practice and bring in models and things like that. And we feel like we're very lucky in our school to have this many machines to practice on, because when I was in school, I was borrowing a machine before the schedule started at a hospital system, and one in my whole class. So the best way to learn ultrasound is physically get in there and scan and learn ultrasound that way. So that's really great about this program. We're very comfy, cozy in the scan lab. So as this is the physical scan lab, and then just imagine another 2 more machines and 2 more beds. We've got it nice and worked out where it's fit like a puzzle, but it's worked pretty good so far. Maybe in the future, we might change rooms as we grow our program, which we are working on. So yeah, after that.
Oh, yeah.
So here's some pictures of some fun things that we do throughout the program. When we first learn ultrasound, we've done some really fun activities of hiding items in Jello and seeing how the sound beam bounces off of those items. And the seniors kind of put some things that they know because they've already taken physics, and show you in your first semester how certain items deal with the sound beams. So that's always a really fun activity. We just started doing that, and I think it's been a fan favorite. We have gone to RSNA, which is a nationwide annual meeting that all people imaging come together, and they look at up and upcoming technology, new and upcoming technology. So things like really cool things that certain big companies are working on, including ultrasound machines. So when when 3D, 4D came out, for you guys have probably maybe seen like an OB or a baby 3D, 4D picture. When that came out, that was like released at this meeting. And we're really lucky to have it so close. It's in Chicago. Now, again, with COVID going on, we didn't get a chance to go, it's online or virtual this year. But in the past, we've gone to travel down to Chicago. We've taken a train or we've rented a van. Depends on the year and how many students we have. But we've gone to Chicago and checked out this. So there's tons of display. Like, what would you say, Lisa? Like 200?
For sure.
On all this technology where CT, MRI, other modalities also are involved, but it's pretty cool because people come through from all over the world to go to this meeting. So we're really lucky to have that close. So we try to do that one time during your whole time with us.
I always think it looks like Las Vegas when you walk in. Like
Yeah.
they put up huge neon signs, like come look at our, display, and they're massive. Yeah, it's pretty cool. Maybe what we can do now is just open it up for some questions. Are there any questions?
Yeah. So did you say we have a certain form you'd like us to fill out when we shadow?
Yes, we have a shadow form. Rachel, do you have quick access to that?
Let me look.
So let's say, Maddie, if you already shadowed and you didn't get the form filled out, we may want to just get something in an email saying you were there on a certain date. If you have the form and you take it with you, that's ideal.
Okay, thank you.
Sure, and we'll email it out. So
Yep.
if you're not familiar with what the form looks like, we'll email that to everyone. And in the same email, we will include those YouTube links if you want to start just kind of perusing those and taking a look. Don't do the activity yet that's associated with it, because I would prefer that you have a physical observation in a healthcare setting if possible. What other questions?
How is everyone doing with their first semester almost in? Okay, figuring it out. Is it getting, I know the beginning is tough. I remember, and I don't remember much in my life. My long-term memory, my long-term memory is not great. Important things.
So classes are going okay? You feel comfortable with the requirements that you have to do between now and next year at this time? Okay. Some other things that you can do. I know with COVID it's hard, and I know that there's a lot of quarantines and things like that happening. But if you feel comfortable, it would be an option for you to set up some time just to come down and take a peek at our lab. Fridays are the day to do that. So you'd want to make arrangements with me. We'd want to make sure that everyone is, okay, health-wise. If you were to come into the lab, you could, we would give you a KN95. We'd have you double mask and we'd give you some eye protection, and you could just stand over to the side. You could watch the students and they could talk to you about what they're learning. And that's kind of a nice way. It's one of the reasons we moved to campus, to allow you to kind of see the program in action. A couple of years ago, we were off campus. So, consider that if you are comfortable in doing so. It's not required, and you can always reach out. Amanda and I are on campus, so we are in the health science wing. If you ever want to just stop by or set up meeting time, we're available. I know Rachel is your point person, and she's a rock star. So she really is probably the best resource for you in your first 2 years, but just know that we're available as well. Anything, Rachel? Oh, yes.
Could you tell us more about like the focusing on specialties, specifically like OBGYN, and like what that route would look like and what sorts of organizations offer those types of specialties?
Mm. You mean when you're done with the program, what you would focus on? Sure. So you have a couple options. Well, you have several options. When you are done with the program and a graduate of Concordia or Aurora, you can go into a large hospital system. Large hospital systems, they can kind of vary. Sometimes they have a general department that does a lot of everything. And sometimes in instances like at Freighter, Amanda can attest to this as well, sometimes they break apart the specialties. So you could be a dedicated breast sonographer, or you could be a dedicated vascular sonographer. I would say in big cities, you're going to see it more specialized out. And in smaller communities, you're going to see sonographers performing everything. In fact, in Sheboygan and in Fond du Lac, we have clinical sites. Well, actually, yes, that they have their echocardiography fused right into their general department. So if you finish the program in general vascular and you really want to add the cardiac component to your expertise, a lot of times smaller um, rural hospitals or smaller city hospitals, community hospitals will cross train you. So that's a really cool opportunity. If you are in the program and you know, I really want to specialize in obstetrics, I would say obstetrics and vascular are the most common kind of specialized areas that can be separated more frequently than others. Those would be private offices, like you would work directly for a vascular surgeon or an obstetrician or their group, and you would do ultrasounds directly for them. You could also go into high risk obstetrics. You could go to a vein clinic where they're doing surgery on varicose veins. Amanda, am I leaving anything out?
I mean, breast is kind of a new thing to be specialized as technology has gotten better. It's kind of specialized out to just being a breast sonographer. Freighter is Freighter does that. And actually, I think St. Luke's is starting to get in more specialized. So I'm a breast sonographer at Freighter, and then I can scan general there too, but that's where my position lies at Freighter. And then I actually do a general position at Aurora where they do breast in their general department. So it really just depends on where you work, where that specialty lies. Just like Lisa said, like Freighter kind of divides theirs out just a little bit more because they're a big system. So they have kind of OB specialty, breast specialty, and then a general vascular department. They also have a vascular lab too. So there's a little bit of overlap depending on what hospital you work at. They've got their big main Freighter, and then they've got smaller hospitals on the outskirts. And then just one thing I wanted to note, if, like Lisa said, if it's something that you guys start with us and get to the end of your program and you're kind of like, I really want to, like, I really loved my OB rotation. I would love to find out more about how I could be a high risk sonographer. I try on the last couple months of your schooling and your spring semester, I try to at least give you your last rotation and something that you feel like you're going to use for your employment. So if there was a site that you really love that's close to home and you want to go back there in hopes of maybe, making a mark and showing your skills off to this site and hopefully getting a job there, I'll send you back there the best I can. So then same thing, if you want to specialize in OB or breast or something like that, and you really loved your rotation when you went there originally, I'll try to get you back there on whatever you really find interesting. Same thing, like children's is a really short rotation, but we've had a couple sonographers or students love children's, and so we sent them back to do their children's rotation again. And we've even had one student go straight from school into a children's position, and she loves it and she's still there. I actually just talked to her yesterday. She's really loving it. Actually, she's specialized twice, so she also went to a vein clinic. So she's kind of took two specialties but kept herself a little bit well-rounded too. So Any other questions around that? Lots of opportunities. That's what's great about ultrasound. It can be fit for any type of person, families, different shifts, things like that.
Okay. Rachel, anything that you want to add?
No, I don't think so. I will send out all that follow-up stuff that we talked about.
Okay. Well, it was nice to see you, even if it's through a computer screen. When we're face to face, we're all like this, so it's nice to see all your faces. Keep working hard, and reach out to us if you have any questions. So we're accessible and available and happy to help. Okay.
Thank you.
And happy Thanksgiving.
Good luck with finals.
Yes. Good luck with finals. Thanks, Rachel.